Welcome back to the deep dive. For years, the conversation around medical cannabis, it's been full of assumptions, hasn't it?
Oh, absolutely, especially about how men and women respond differently.
Right, assumptions about effects, side effects, this idea that the differences are just, well, biological facts.
Exactly. Accepted wisdom, almost.
But what if that wisdom was really just a product of how we've been studying cannabis?
That's the million-dollar question this new research tackles.
So today, we're taking a really illuminating plunge into a scientific article that challenges exactly that. It's titled Evaluating Sex Differences in Efficacy, Safety, and Pharmacokinetics in Patients Treated with Cannabis by a Metered-Dose Inhaler.
Quite a mouthful, but the content is fascinating.
Our mission today is to unpack its insights, especially around, male versus female responses to medical cannabis and the crucial role a specific delivery system plays.
And what's really striking here is how this research doesn't just, tweak our understanding. It feels like it could fundamentally reshape it.
So?
Well, by controlling variables that were previously, frankly, all over the place, this study gives us a much, much clearer picture. It could genuinely change how medical cannabis is prescribed. It's a great example of methodology making a huge difference.
Okay, let's unpack that. We've all heard stories, maybe even seen older studies suggesting differences in how sexes experience pain or react to drugs. This research looks right at that with medical cannabis, but with this key difference. A really consistent delivery method. They use the SyqeAir Inhaler.
Right, and that device is central to the whole thing.
It produces and releases an aerosol from the actual cannabis flower, the inflorescence, and it's designed to give consistent, metered, and uniform doses of A9 THC.
That consistency, that uniformity, that's the game changer here, as we'll see.
So before we dive into the study's really groundbreaking findings, maybe let's set the stage a bit. What do we think we knew about sex differences in pain and drug response, especially with cannabis?
Well, historically, clinical studies did often suggest pretty significant sex-related differences. For instance, women were often reported as being more susceptible to adverse event side effects.
Okay.
And we know women tend to experience certain chronic pain conditions like migraine or fibromyalgia much more frequently than men.
Right, that's well established.
So that led to this general idea that maybe the female body just processes or reacts to cannabis differently. Some older studies even suggested men got more pain relief from it, which naturally made researchers wonder, are these differences truly biological? Or are other factors confusing the picture?
Like what kind of factors?
Well, animal studies, for example, showed that sex hormones, estrogen, testosterone, can influence our body's own cannabinoid levels, the endocannabinoids.
Our internal system.
Exactly. That system regulates so much pain, mood, sleep. And hormones seem to affect how males and female rats respond to pain and to cannabis administration. So there was a solid biological hypothesis.
And in people?
In humans, some research hinted women might be more sensitive to the psychoactive effects of THC, even at lower doses, and maybe faced a higher risk of adverse drug reactions generally. It paints a picture of a complex interplay, doesn't it?
Definitely complex.
Absolutely. And the cannabis plant itself adds another layer of complexity. Hundreds of compounds, not just THC and CBD, but all these other phytocannabinoids and terpenoids.
The things that give different strains their unique profiles.
Precisely. And older research really struggled because you had all these different cannabis cultivars, different strains, plus really inconsistent delivery methods, smoking, edibles, different vaporizers.
Right, it's hard to compare apples to apples.
Exactly. So this study aimed to cut through that noise by using just one uniform cultivar and this very specific inhaler.
Okay, this is where it gets really interesting. The SyqeAir Inhaler. Tell us more about why this device is so critical for their research. Why is it such a game changer?
Well, the SyqeAir Inhaler is specifically engineered to deliver a highly consistent and uniform concentration of THC into the bloodstream when someone inhales the aerosol.
Okay.
This meter dose capability is just crucial. It drastically cuts down on the dosage variability that's always plagued cannabis research.
How so compared to, say, smoking?
Think about it, smoking, even traditional vaping. The actual dose someone absorbs, it can vary wildly. How deep they inhale, the device itself, it's inconsistent. This inhaler delivers a specific metered amount every time.
Consistent, uniform, metered. Got it.
And that consistency lets the researchers isolate the variable they care about, sex differences. It helps eliminate those confounding factors like different plant compositions or wildly different doses people were getting before.
Which led to messy data on how the drug moves through the body.
Exactly. messy pharmacokinetic profiles, or PK profiles. This inhaler makes those PK profiles much more predictable and comparable.
So with this tool, how did they actually structure the study? What did it look like?
They used two main approaches. First, a big real-world study. Over 1,200 Israeli chronic pain patients followed for 240 days. They tracked pain levels, sleep, any side effects.
So observing typical use over time.
Right. Then second, they reanalyzed pharmacokinetic data, the PK data from two earlier double-blind studies.
Looking at blood levels.
Yes, focusing on actual blood levels of THC and its metabolites, what the body breaks it down into, plus things like blood pressure and heart rate after a single uniform dose from the inhaler in a smaller group.
A two-pronged approach.
A robust combination.
Mm-hmm.
Now, it's worth mentioning, just for transparency, the study was fully funded by Syqe Medical, the company making the inhaler, and some authors work for or consult with them.
Okay, good to know the context.
It's standard practice in device research, but important for critical evaluation. And critically, all patients use the same cannabis cultivar bedrocan, so the plant material was consistent too.
All right, let's get to the results. The moment we've been building up to. With this controlled environment, uniform dosing via the SyqeAir Inhaler, what did they find about effectiveness? Did men and women respond differently?
This is really the core finding, and it directly challenges those old assumptions. Quite surprisingly, no significant sex differences were found.
No difference at all.
Not in the long-term effectiveness or safety of the treatment when delivered this way.
Wow. Okay, that's huge. So what does that immediately suggest about all those previous studies showing differences?
It strongly suggests a lot of those differences might have been, well, artifacts of the methods used, not fundamental biology, standardized the delivery, and those differences seem to vanish.
Can you break down the pain relief part?
Sure. So interestingly, women did start with slightly higher average pain scores at the beginning, baseline in day 7.
Okay.
But after that, at most other time points, their pain intensity was very similar to the men's. And the change in pain from baseline was also similar for both sexes overall.
So significant relief for everyone.
Significant pain reduction for both groups, yes. There was one small point at day 14 where women showed a slightly better reduction, but overall the long-term picture was equal effectiveness.
That's really fascinating. What about the actual amount they were using, the dosage?
Another really crucial point here. Initially, if you just looked at the raw daily dose of THC, men did consume a bit more at a few early time points, days 7, 21, 30.
Okay, so some difference initially.
Yes, but, and this is key, once they adjusted those doses for body weight,
Ah.
those differences disappeared completely. No significant difference in weight-adjusted dose between men and women at any time point.
So weight matters more than sex for dosing here.
That's what this strongly suggests. It highlights how important weight-adjusted dosing could be, potentially making sex-based assumptions much less relevant for this kind of delivery.
That's a massive takeaway for anyone using or prescribing medical cannabis. What about sleep? That's often a big issue with chronic pain.
Right. And here again, good news across the board. Sleep latency, how long it took to fall asleep duration, and quality all improved for both men and women.
And any difference between them?
Nope. Crucially, no sex-related differences found at any time point for sleep improvements. Suggests the benefits extend beyond just pain relief, and equally so.
Okay, and safety. The side effects.
Okay.
That old idea that women experience more, did that hold up here?
Again, the study flipped the script. The overall rate of adverse events, or AEs, was equal. And relatively low, actually about 10% for both women and men.
That is low. And were they serious?
No, none were severe. They were reported more often right at the start than decreased. Most common were things like mild dizziness, a bit of a cough, maybe a headache, manageable stuff.
And absolutely no difference between men and women in those rates?
None. No difference in overall rates, none for specific body systems, none for specific types of side effects, equal safety profile.
It's almost hard to wrap your head around, given the previous narrative. What does this really imply about those earlier findings suggesting women had more AEs?
It really points the finger at the heterogeneity, the variability in earlier treatments.
Yeah.
Different cannabis strains with vastly different chemical makeups, plus inconsistent dosing from smoking or whatever. That seems to be the likely culprit.
Not necessarily inherent biology.
Exactly. Control the cultivar, standardize the delivery with something like the SyqeAir Inhaler, and that disparity just seems to disappear in this study population. It's a powerful argument for standardization.
So beyond the real-world data, they also looked at the pharmacokinetics, right? How the body actually processed the THC. What did that layer add?
Yeah, the PK data really reinforces the main findings when they looked at the blood levels of THC and its main metabolites.
What the body turns it into.
Right. No sex-related differences were found at any time point after that single uniform inhaled dose.
Not at all.
None. And similarly, no significant differences in cardiovascular measures, either blood pressure, heart rate between men and women.
So the body's processed it the same way, basically.
When delivered this consistently, yes, it appears so. This really supports the idea that with consistent metered dosing, the body's handling of medical cannabis doesn't significantly differ between sexes.
And how does this relate to getting the dose right? You mentioned a therapeutic window.
Exactly. Previous studies, often using higher or less controlled doses, might have shown much higher THC levels in the blood, potentially pushing people outside that optimal therapeutic window where you get more side effects than benefits.
But these lower, consistent doses stayed within it.
It seems that way. The low uniform doses from this inhaler appear to keep patients within that beneficial range, contributing to both the good effectiveness and the lower rate of side effects, equally across sexes.
So the consistent uniform dosing seems absolutely key. But you mentioned transparency, no study's perfect. What were the limitations here we should keep in mind?
Absolutely. Critical thinking is essential. Like many pain studies, it used a subjective pain scale, patients rating their own pain. Standard, but not objective. There was also a notable patient dropout rate over the 240 days. That happens in long studies. But if the people who drop out are different from those who stay, it could potentially skew the long-term results.
Makes sense. Anything else?
The PK study part, while really informative, had a relatively small number of women participants. So we need to be a little cautious about generalizing those specific blood level findings too widely just yet.
And the real-world part wasn't blinded.
Correct. It was open label. Patients and researchers knew they were getting the cannabis treatment. So you can't completely rule out a placebo effect contributing some improvement, though the consistency across sexes and with the PK data makes that less likely to be the whole story.
And the inhaler controls THC dose, but maybe not everything else in the plant.
Right. Even using a single cultivar helps massively. But cannabis has many compounds. The inhaler meters the THC aerosol effectively, but the exact profile of other inhaled cannabinoids and terpenes isn't controlled quite the same way, although much more consistent than other methods. Important nuances to remember.
Okay, this has been a genuinely fascinating deep dive. The big picture seems to be that when medical cannabis is delivered consistently with metered, uniform doses, like via this SyqeAir Inhaler.
Producing that aerosol from the flower.
Right. Then many of those previously assumed sex differences in how well it works or how safe it is, they just seem to melt away.
The huge takeaway really is the power of standardized delivery.
Yeah.
It strongly suggests that maybe some of those perceived differences between men and women were more about the inconsistent products and methods being used.
Rather than fundamental biology.
Precisely. It really pushes us to question those broad generalizations and focus on the why. It champions a more methodical approach.
So for you listening, what does this mean? For clinical practice, for policy, it points towards a potential major shift, doesn't it? Towards more evidence-based, standardized dosing.
Maybe thinking about weight-adjusted dosing much more seriously.
And moving away from just assuming different products are needed based on sex. Imagine getting more predictable results for everyone.
And it sparks a broader thought, too. If uniform delivery can harmonize responses to something as complex as cannabis, how much more could we optimize treatments across the board by focusing intensely on controlled delivery for all kinds of medicines?
Yeah.
It leaves you thinking that maybe how a drug is delivered is just as critical, maybe even more critical sometimes than the drug molecule itself. That's a profound shift in perspective for medicine.